Hi friends, I'm Adira Rajendran, one of the faculties from Bliss Institute, Sharjah. Today I'm here with some videos for RN nurses, registered nurses, some questions related with UAE ministry examinations. Before that, we would like to introduce ourselves, and Bliss Institute Sharjah is here for the last 16 years, and we helped most of the healthcare professionals to pass their examinations to work here as well as in other countries, especially the language proficiency test. And we have branches in India, especially in Kerala, Kottayam and Thiruvalla. And we are here all time for you and to fulfill your needs, as well as you can ask us for any queries related to your education, examinations and other job related queries. So we will update all the status on time, and anytime it will be available for you. And today I came here with some questions. It's for RN nurses. And as you know that Sharjah examinations, MOS examination, the students mostly will get 100 questions. Among these 100 questions, they need at least 85 right answers. And recently there were some updations in the questions. Everywhere it is there. And the questions I can discuss today is with registered nurses. They are degree holders, means we can say BSc nurses. And the questions are different for practical nurses. They are diploma holders, it's GNM, and degree nurses. And now I came here to explain you some questions for registered nurses. They are degree holders or post BSc nurses. Then the first question, it is related with the tardive dyskinesia. So the question is related with some psychiatry conditions. And tardive dyskinesia, it means movement disorder. Mostly it is a side effect of antipsychotic medications. And the antipsychotic, they have given you an example related with haloperidol. So most of the scenario is depending on the schizophrenia patient. Antipsychotic, haloperidol side effect they will be asking you, or directly they will be asking you the side effect of antipsychotic. One question. Or direct question, you can expect that tardive dyskinesia means what? So all are related. Tardive dyskinesia is associated with movement disorder. It's actually related to dopamine depletion. We can call it as a pseudo-Parkinsonism. So when it comes with the Parkinsonism related question, or when it comes with the side effect of antipsychotic or haloperidol, you can expect this tardive dyskinesia. And it's related with the dopamine receptor. So you have to read the scenario carefully and find the answer which is related with the dopamine related things and this. Other than this, a relation thing you can see with the tardive dyskinesia, movement disabilities, and this dopamine relation is with the drooling of saliva. So drooling of saliva is also relating with this kind of side effects. So it's a definitive question you can expect anyone. As I said, several types, different type will come under. So this is a definitive question for RN nurses. The last week also this question appeared in the exam. Then another question is coming from phobia. So phobia management they will be asking you. And mostly there is something related with the age factor in phobia. Directly they will ask children, and sometimes it's adult. Before answering the question, make sure whether it is a child or an adult. In the case of child, first of all, or adult, first of all we have to identify the phobic factor, what causes the problem. So find the answer, and first of all you have to ask what is the reason behind, or you have to identify that the reasons of this phobic situation. So verbalize the feeling and assess the feeling. This is the thing which comes under first. And the second thing is that if it is a child, your management will be diversion. Don't expose the same situation. So diversion will come under. But in the case of adult situation, you can diversion but gradual desensitization of the phobic event. So gradually we are exposing the person and desensitize this phobic episode. So this is the management for both adult and child. Make sure in which age group the person is coming. So scenario is very important. So this is a second question you can expect from psychiatry, and we'll check with some questions you can see in UAE community questions. So they will be giving you some examples related with the incident rate, something like measles related informations and some death rate, means crude death rate and specific death rate related informations. So these prevalence rate, incident rate, crude death rate and specific death rate. From these, any one question you can expect. Here the last question is related with this rates of measles death, mostly related with the crude death rate and specific death rate. So they will give you some information related with several deaths associated with several diseases, and the percentage is decreasing to a thing, and they will be asking you in an year the death rate for measles, how it will be calculated. Exactly, they asked related with the specific death rate. Only one disease they have chosen. So you have to identify the formula, and mostly they will be asking you the formulas. So the scenario will be given. So you have to identify whether it is incident, whether it is prevalence, whether it is death or other. Then the formula should be assessed and you have to click the right answer. So this is a question. Then another new question appeared recently is related with the UAE community, is with the mammogram and the colonoscopy. Mammogram, it risk group means every 2 years they have to perform, and under not risk, that means above 40 every 2 years, under 40, under 39 it's every 3 years. And the same time colonoscopy every 5 years in risk group and every 10 years in non-risky. So these all are the few questions for RN. It's recently updated, so check with the question, and the rest of the questions will be discussed in the next videos. And thank you for watching us.